Welcome to CRT. I'm Bambi Francisco Roizen. I'm speaking with Dr. Harold Koenig. He's founding co-director of the Center for Spirituality, Theology and Health at Duke University Medical School. The center was founded in 1998 to conduct research and promote dialogue and discussion around spirituality, religion, and health. He's authored almost 700, nearly 700 scientific peer-reviewed articles. He's given testimony on Capitol Hill on the benefits of religion and health. He regularly trains chaplains and religious leaders across the branches of the U.S. military, and his work shows significant evidence-based studies that religion and good health are highly correlated. Welcome, Dr. Koenig. Thank you for your work.
Thank you, Bambi, for having me on your program.
Well, you're trained as a psychiatrist and family doctor and doctor of geriatrics. Where did the interest in religion and integrating religion into your practice originate?
Well, it probably originated when I was a nurse. I had been a nurse before becoming a physician, and it was then that I was trained to ask patients about how they were coping with their illness when seeing patients in the hospital. So I carried that over into my medical training, and many patients would report they were coping with their illness through their religious faith. And so I found that fascinating. So I thought that maybe we needed to document this more carefully. This was in Springfield, Illinois, just south of Chicago, southwest of Chicago. And so I started documenting it in a systematic way and began reporting it in academic journals.
So you come through this as a scientist, through a scientific lens more than a religious lens. Do you have a religious journey? Did you take any religious courses or courses on religion?
I have no training in religion or ministry. I'm entirely medical, psychiatric, and science based. I do have a faith journey, however. I was raised a Catholic, and then, in my later years, uh, became kind of a non-denominational Protestant. So now, I feel as comfortable pretty much in, any Protestant or Catholic church or mosque, Jewish synagogue or Islamic mosque as pretty much anywhere where primarily monotheistic with regard to my beliefs are centered in the Abrahamic religions, and so that's kind of my faith journey. And certainly as I've grown older, I'm now in my mid 70s. I've uh, found that religious faith has been very helpful in coping myself with the various physical health problems that come on when you get to my age.
Mhm. And it may be the case too that it's something that you want to share with others because not only have you found evidence in a lot of the studies that you have done, but it's also personally that is, as a Protestant, you would say that that is part of your belief system is to share that good news. So there's a different sort of angle there in terms of the rationale behind why you do what you do.
Yeah, I think I value it because of my personal experiences, and therefore I feel that it deserves to be studied, and other healthcare professionals should know about it for the benefits of their patients, many of whom are religious.
Let me ask you, I mentioned that you've done almost 700 scientific peer-reviewed articles. Are these all studies that show the connection between religion and some sort of mental health disorder? I saw the lecture that you gave to a room full of chaplains, and you talked about studies that showed depression is less common for those who are religious. Religious intervention reduces depression as quickly or faster than secular interventions. Religious involvement helps with hope, purpose, meaning, and greater social support. How many studies have you conducted that show this correlation between religion and better health? And could you also define what you mean by religious intervention and religious involvement?
Yeah, it's not just our studies. People are now scientists all over the world, including at some of the best academic medical centers in the world, are now reporting these findings. But there have literally been thousands of studies now, quantitative, peer-reviewed academic publications from research, standardized, scientific research showing these connections with mental health, with social health, with behavioral health, as well as physical health. I think the physical health findings are probably the most notable in terms of, for a healthcare professional such as myself and my colleagues, are that religious involvement actually enhances your physical health and the medical outcomes that you're likely to experience when you become sick.
And how would you define religious involvement, religious intervention? What is that?
So, okay, now there are two things. One is religion. What am I talking about? And then what is a religious intervention? So, with regard to religion, I use a broad definition of it to include really religions, the major world religions. It's not limited to any one particular religion, although most of the research has been done within Christianity. Uh, there is comparable research in other faith traditions as well. And I use again a broad definition. It's not just attending religious services. It's about personal religious activities such as praying to God, meditating, reading the Holy Scriptures, whether that be the Quran, the Bible, the Torah, um, even the Dhammapada in Buddhism, or uh, the Bhagavad Gita in Hinduism.
Mhm.
So, a wide variety of religious activities, including involvement within a religious community, but not limited to that. Also, personal kinds of religious activities and personal commitments, belief in connection with the divine.
And when you look across all those different major religions, have you done studies that compared the different religions in terms of the efficacy of those different religions compared to each other?
Yeah, it's very challenging to do that for many, many different reasons, scientific reasons, actually. For example, to compare Christians and Buddhists in the United States is biasing against Buddhists because they're a minority religion in a majority Christian country, and therefore there are social and cultural influences that affect their health. Being a minority, there are, these negative effects that being a minority in a largely Christian country have. And
Mhm.
and the same if you're comparing Buddhists and Christians in China. You have that same issue where now the Christians are in the minority and now they're experiencing uh, stressors from the culture. And this is true for all of the major world religions. I spent a lot of time in the Middle East, in Saudi Arabia, and the same there. Christians are under, some degree of cultural pressure in a country like Saudi Arabia, and Islam is very strongly related to better health and greater well-being in the Middle Eastern countries. So again, to try to compare, it's almost impossible to provide a fair comparison. Which you can say, however, is devout religious practices in any of the major world religions, the five major world religions, probably is good for your health.
Can you show, as opposed to correlations between religion and better health? Can you show that religion improves health?
There's evidence from well done epidemiological studies that show that this is not just a correlation, but it is highly likely that this is a causal relationship. In our latest edition of the Handbook of Religion and Health, my co-author, Tyler Vanderweel, is an endowed professor at the Harvard School of Public Health. He's the world's most renowned statistician on causal inference. He wrote the books that statisticians learn from on causal inference. And we have in this 1,100-page book, the Handbook of Religion and Health, hundreds, thousands of studies, many of which have been analyzed in a way that provide evidence towards causality, and also with regard to religious intervention in terms of randomized controlled trials. I never did explain what a religious intervention was, but
Oh, yes.
yeah,
You did.
a
You
religious
did.
intervention would be, for example, a religiously integrated psychotherapy for the treatment of depression, anxiety, or other emotional problems. And so we've done randomized controlled trials using a religiously integrated version of cognitive behavioral therapy for the treatment of depression. And what we find is that it reduces depression with large effect sizes, large effect sizes. Um, so, if you can utilize religion to reduce depression, then that would suggest it's a causal factor in terms of improvement of mental health.
Now, you mentioned CBT. I'm a big fan. I've been sort of looking at CBT for the last, well, not very long. It's been around since the 60s, but I have been researching it for the last 10 years, looking to invest in companies that offer CBT. That's been really popular in Silicon Valley, having companies integrate CBT into their practices. How would you describe the difference between sort of regular CBT and a religious CBT? Because, religion is a totally different, there's it just doesn't change your mind about, changing behavior and changing your mind from negative thoughts to positive thoughts, but it changed your meaning, your purpose. It's far more existential. Do you think the religious CBT improves mental health more than CBT?
Well, I do think it probably does in religious patients. And cognitive behavioral therapy, you know, actually, the people who developed cognitive behavioral therapy, Aaron Beck and colleagues, really got it pretty much from
Yeah.
the scriptures,
Mm.
because the scriptures are all about changing the way you think, the way you behave in ways that enhance your life. Um, so in many respects, it's very easy to integrate religion into cognitive behavioral therapy by simply, having a person, as in therapy, challenging their negative cognitions by their scriptures, what their holy scriptures say about life and the truth, whatever it is that's out there, and having people think more rationally in terms of their lives, in terms of dealing with stress and change and treating other people, and as you said, deriving meaning and purpose in life, and all of these factors have to do with your cognitions. They affect your behaviors, how you live your life, the kinds of habits you develop, whether you drink, whether you smoke, whether you use drugs. All of these things are all influenced by religious beliefs.
Before I talk about sort of the treatment, the CBT and religion, just tell me, I want your definition, or I want you to describe why religion is so effective. For me, as I've been studying this for not as long as you have, but I have been studying this for quite a bit. And from a scientific basis, of course, religion and prayer releases all those neurotransmitters, like particularly oxytocin, the love hormone, but other type of hormones like dopamine. And so that's really good for our mental health. How do you describe why religion is so effective in giving us mental and physical well-being?
Yeah, I think it has to do with the way people think, their beliefs, their social interactions with others, and their behaviors. All of those factors influence a person's mental health. So if you have hope in life, if you have purpose and meaning, if you feel like you can make a difference, you're working with God to make the world a better place, that's going to enhance your mental health. If you're loving your neighbor as yourself, if you're being kind to others, if you're forgiving others, if you're doing all those good things, that's going to influence your mental health. And if you're living a healthy life in terms of avoiding alcohol, not smoking, eating a healthy diet, respecting your body as the temple, of God, all of these factors influence your mental health. It really makes perfect logical sense why religion ought to influence all of these aspects of mental, social, and behavioral health, and consequently influence physical health as well.
Well, you're a big believer in religion addressing mental health. Not only that, you come with the receipts, right? I mean, you come with all the evidence. I particularly like the MRI scans that show that brains that are religious don't have all of the red stuff. I can't remember what that red stuff represents.
Yes, it's
Um,
shrinkage. It's shrinkage of the cerebral cortex. That's Lisa Miller's work.
Cerebral cortex. Okay, you have that evidence. That's pretty significant, objective. You can see it. Um, and you have, I mean, you have so much evidence, and yet the predominant first line of treatment for mental health is antidepressants, even more so than CBT, with so much evidence backing, your research. And now it sounds like thousands of evidence-based research. Why is it that we're still administering psychotropics? We're still doing CBT before we even do religious CBT. Why aren't we getting religion into the workflow?
Okay, so first of all, many of the mental health conditions that people have to endure, they are biologically driven. So that includes depression, anxiety. These are biological illnesses of the brain, or at least components of it are biological illnesses. And therefore, you have to treat them with biological treatments, whether that be antidepressants, whether that be electric shock treatment, whether that be, other newer forms of magnetic eminence, repetitive RTMS. Um, so yes. Now, the thing is that about 10 to 20% of people have emotional conditions that are biologically driven, and they need these biological treatment. But the 80% of most of the world that's left don't really have biological, they're coping with just problems in their life. They're a loss of a loved one, or a broken relationship, or they've lost their job, or they get sick, and they don't have a biological, they're just having trouble coping. For those individuals, religious forms of treatment work beautifully. But for some, they need they need the medicine.
I saw a study, I don't have it on hand, but I saw a study that showed that it was, under 5% of those considered sort of suffering from some sort of mental disorder, were really serious, bipolar depression. But I'm talking about so say the World Health Organization has a study, and by the way, these numbers haven't moved. They've always said about 20% of people in the world are suffering with some mental disorder. Are you saying that that 20% is something biological, or I always thought that encompasses people who are also suffering from anxiety and depression, mild forms of anxiety and depression?
Yeah, probably 20% is a good figure in terms of those who have a biological illness that's driving their emotional symptoms. So, and it's not one or the other either. It's, you can have a combination of both biological as well as, just trouble coping. So, it's not one, either you have an entirely biological illness or you don't. I mean, there is the spectrum of cases of people with a little bit of biological illness and a whole lot of just making bad decisions in life, and those who have a lot of biological illness and just a small component is making bad decisions, and yet they're suffering greatly. And sorting that out is challenging. It's challenging. Most of the emotional challenges that we face can easily be addressed through religious counseling, through being part of a faith community, seeking support, giving support to others, reading the Holy Scriptures, cleaning your life up. Many people will do, and yet some of those individuals will also need medical treatments and electric shock therapy, maybe, or RTMS, or other forms of biological treatments. Again, it's on a spectrum.
I understand that. So it sounds like you're saying 20% of those considered or of the population have some sort of biological sort of imbalance. Maybe it could be mild. Do you think that the World Health Organization says that it's one of the most pressing public health challenges we face today? I've heard that over the last 10 years that it's been a public health challenge. Has it grown to become a public health challenge in the 21st century? Has it always been about 20%, even in the 20th century? Why does public health seem to be a health challenge today? And so there's two questions in that part. Is that,
Sure, sure.
has it always been
Yeah.
20%?
My guess on the answer to that, it's probably has large, well, at least within the last couple of hundred years, it's probably been around 20% of the population has a biological illness. The same with regard to diabetes, or high blood pressure. Those prevalence rates really have not changed too much, except that they've been influenced by eating habits, etc. So I would suspect that the biological components have been pretty constant. You see, but the fact is that the United States and the whole world is becoming more secular. For example, just last year, the Gallup poll did a survey of the United States showing that only about 50% of Americans say that religion is important in their lives, whereas back in 1952, the percentage was 95% of Americans said religion was an important part of their lives. That's dropped all the way down to 50%. And in fact, the Gallup poll said that the rate of decrease over the last 10 years of religious importance in the United States was the fastest of any country in the world. So in particular, people in the US are becoming less religious. And as a result, that other 80% of people who really don't have a biological illness, they're not doing so well without religion. They're just not doing so well. they're not coping as well. They've got more anxiety. There's more substance use, more alcohol, drugs, etc. As people seek to fill a gap inside of them that only religion can fill.
So it's interesting. I almost thought you were saying that the secularization of society has affected us. This cultural shift has affected us even biologically. But then it
I
sounded like,
don't, there is some evidence that yes, that situational factors can actually change the biology of the brain. There is that neuroplasticity, that we've heard of how that environments and can affect nerve synapses in the brain. So to some degree, you might be correct in that as we become more secular and have turned away from traditional sources of coping and making sense of the world, that over time it could very well be that biological illnesses could be increasing. Could be. I don't think we have any evidence of that, but it's possible. It's certainly logically possible.
I think that there could be studies done, particularly in a lot of the younger generation, in terms of being able to, without them having some sort of rock or anchor, so Christ, to have an identity. And in those formative years, going through those years where they're confused, that could, yes, they have neuroplasticity, but that could affect their brain development. And then it could be biological if they're going through those formative years going through an identity crisis. They're already going through identity crisis when they're young because they're trying to figure out who they are. And maybe without, having uh, Christ there as a rock, that even impacts their brain development even more. And
It's
there's,
possible. I agree. I think that's possible. That again, because the brain is so neuroplastic, it changes in response to environmental stressors. It is possible that the brains, are changing. And maybe biological illnesses are becoming more common. But in general, I would say we have plenty of reason outside of biology to not be doing so well.
yeah. Christianity embraces suffering, and this goes to sort of the treatment, and the treatment maybe what the treatments lack that Christianity offers. So Christianity embraces suffering. My favorite verse is in Romans 5:3. Suffering produces endurance, endurance produces character, character produces hope. Our identity and this sort of cultural reliance on externalities, whether it's a therapist or even an antidepressant, it sort of it does not embrace the internal suffering that we need to find joy and peace in. And that seems to be lacking in the secular treatments.
Well, that's an interesting point that you raised there. Um, the secular treatments work, in terms of, the cognitive behavioral therapy, for example, works in helping people to think more realistically and more positively. And that's a good thing. That's a good thing. I think that is helpful. I think you, depression and anxiety can also affect your ability to tap into your religious or spiritual resources. So if you can treat the depression, if you can treat the anxiety, whether that be that through secular therapies or through medication, then it may be that people will be more able to access their religious resources. So what I see these two areas working beautifully together. They really do complement each other because the secular treatments, the medication, et cetera, the biological treatments, they can address certain issues that will help a person of faith, tap into their faith resources more. And then the person of faith who taps into their resources then they won't need as much medication or as much secular psychotherapy. So it'll free people up, free up those therapists for others who really need them who are not religious.
Now, I know that I'm going to be critical of the industry that you're part of, which is the psychiatric industry, particularly the Diagnostics and Statistical Manual of Mental Disorder. There are
Yes.
210 disorders published in 2000, but that was quadruple from 100 back in the 50s. And I'm wondering if the broadening of the term in and of itself, or the terms, would expand the number of people considered mentally ill. There's a name for that. If somebody has some sort of hang up, and there's a name for that, and then there's a treatment for that. It just seems everyone fits into this bucket, which is sort of the natural process of life, just another form of suffering.
Yeah, that is an argument that has been presented frequently, that that we're making diagnoses out of normal problems that people are facing. And in fact, it's even been applied to this area called moral injury, which we've done a lot of research on lately. And in terms of, and we are actually have successfully got it into the DSM now. And that's just within the last 12 months that we've been able to include
Really?
moral problems as part of the DSM. So the
Oh,
argument that's been against that is exactly what you just said, is that we're making just normal kinds of challenges with regard to transgressing our moral value. Made that into an illness now, when in fact that's pretty much everybody is having trouble, meeting the high standards of moral and ethical values, and they're experiencing some guilt and shame, and they get over it. But some people don't get over it. Some people get stuck into the guilt, the shame, the self-condemnation. And that's when we think moral injury deserves some clinical attention. And so it's a good idea that it's in the DSM, simply because once it gets into the DSM, it'll get much more attention in terms of research. And then also it will enable, billing in terms of insurance coverage of, say, pastoral counseling to address some of these issues, rather than just, the chaplains and the clergy doing it all for free while only the secular people are getting paid. Hey, well, why shouldn't some of the clergy get some? They're using their time and their skills to help people work through these issues. And so that's kind of the argument that would be in favor of including things like that in the DSM. But yes, we definitely have taken a lot of emotional disorders or emotional conditions that involve suffering and have put labels on them. And, to some degree, that's been helpful because of the new medications that have been developed to treat some of these conditions. So it's got its pluses and its minuses.
well, I'm not a big fan of adding to the DSM, but I do like moral injury. When was that added?
It was just the last year.
No, really?
Yes, in the
Wow.
last year, it was added. There was a Z code. Now, it's not a diagnosis, but it's a Z code, which means it's a condition that requires further study and research. It used to be religious or spiritual problem.
Hmm.
Now it's moral, religious, or spiritual problem. And there's, I think, a sentence in there that says, that there's emotional distress that results from transgression of moral values, and that sometimes is severe and sometimes drives people even to suicide. So because it has these enormous potential negative effects, it deserves clinical attention, and that's how we got it in there.
But there's no diagnosis. You can't diagnose somebody with that yet.
No, no, it's just a Z code. It's a moral, spiritual, or religious problem. It's not a formal DSM diagnosis. It's a Z code, which
Okay.
is, conditions that require further study.
Okay. But still you can get reimbursed for that?
I'm not sure that at least in the United States you can get reimbursed, but I do believe that for a religious or
Pastors.
spiritual problem in the ICD 11 that now may be reimbursable, but I don't think it's reimbursable in the US yet.
Okay, so pastoral counseling, if somebody the pastors can't go to insurance companies, or you can't say that I've received pastoral counseling because I have this Z code moral injury, moral religious injury. You can't,
I
pastors can't.
don't think so. I don't think so. And
Is the
but
point
now
of
now
that?
there are two types of pastoral counseling. One is a licensed professional pastoral counselor, and then there's the counseling that clergy do, which is also called, pastoral care.
Yeah.
So the licensed professional counselors who are licensed in the state to provide counseling, who do pastoral care. Um, I'm not sure. I don't think that they can get reimbursement other than, you know, they're not going to code it like that. They're going to code it as depression or anxiety and then get reimbursed. But
Okay.
but clergy don't get reimbursed for what they do unless they're licensed in the state to
Yeah.
provide counseling. Clergy are just going to do it, members of their church, their congregation, they're going to provide some marital and some situational counseling, and they're
Okay.
not going to get any money for that.
So let me understand this then. The fact that moral injury is in the DSM, I mean, isn't the point eventually that that those administering some sort of maybe religious CBT could get reimbursed because somebody was diagnosed with moral injury? I guess I'm trying to
Some
connect. Yeah.
someday, we're hoping that there's enough research documenting the negative effects of moral injury that it will become moral injury disorder. And then it will be a disorder in the DSM and maybe the ICD 11 or 12 or 13 by then. But this is not going to happen for at least another 10 years until more research and study has been made of the topic. It's very recent, this topic of moral injury. It's only been the last 5 to 10 years that it's even gotten into any attention from in the mental health field. So it's still very, very new. But basically, moral injury, um, the things that cause moral injury are results of transgressing of moral values. And in the religious world, we call
Sin.
that's correct.
Okay. So being sinful is a moral injury disorder. And
Being sinful can result in moral injury.
which
And
is guilt.
possibly, and
Okay.
if it affects a person's functioning, if people are so guilty, so full of shame that they can't work, they can't relate to their family, then it's become a disorder. Yeah.
Okay. That's interesting. I'm I mean in many ways I think I would be a proponent of something getting into the DSM to, to help pastors or those giving religious guidance, sort of on par with secular therapists and others
Yeah,
who are,
sure.
but I'd have to think about it. It is relative,
Yeah.
as you said. I have something else to ask. It's a bit controversial, but in 2013, the American Psychiatric Association changed the term gender identity disorder to gender dysphoria. And I think that was a mistake because it shifts from pathologizing a cognitive confusion to the depressive response. And in so doing, I believe we're affirming a delusion rather than confronting the psychological reality. What's the consequence of teaching people that subjective belief, their lived experience, is more true than objective reality? And why? And should we change gender identities? Should we bring back gender identity disorder?
Well, I'm not an expert in that particular area, so I probably would would reserve commenting on it. But
Okay, it is a controversial one, but
yeah,
let's
yeah.
go to the diagnostics. Today, the way to diagnose mental disorders, and this has been popular for forever, that since the last decade that I've been really following this closely, it's the PHQ-9 or the GAD-7.
Yes.
Always not like these. These are self-reported forms. I can go on there and feel extremely depressed one day and probably fill one of those out, and you can probably say I need to into the hospital. Um, you have so many studies, evidence-based studies now. You have the brain scans we saw. Technology has advanced so much. Why aren't the brain scans being used? Why aren't other technologies being used that actually look at biomarkers, biological markers?
Well, part of it is because we don't have there are no funding sources to provide money to conduct studies like this. You know, the NIH doesn't support research on religion and health because they feel, there's a conflict there. And so now the Templeton Foundation has been supporting research in this area, and they have supported Lisa Miller at Columbia University, who has done the brains, the MRI scans of the brains and has published that. They have been supporting work that she's been doing and her colleagues have been doing up there. Um, but again, there's not much money out there for this kind of for research in this area, and it's holding things back. That it is holding things back. The fact that they're only the maybe the broad aspects of spirituality are being funded. For example, maybe some of the mindfulness meditation studies that are rooted within the Buddhist tradition, or various yogic types of exercises. These are getting support by the national the National Organization for Complementary and Alternative Medicine. Um,
Mm.
many of the broader forms of spirituality are getting support, but anything traditionally religious has really, the secular world is not really not wanting to invest much money there.
Well, it's interesting. The Robert Kennedy Jr. has really liked these wellness farms. I don't know where the information is, but he is a really big proponent. I'm going to speak to one of those wellness farms, and they are based in on religion, or at least there's a lot of faith-based components in those programs. They're for alcoholics or for drug rehabilitation. What do you think of those programs? And are you familiar?
Um, well, I do know that the 12-step programs are very, very effective and help people recover from alcohol, from drug addictions, from all sorts of eating addictions, sex addictions, video game addictions. They're very helpful, and there are online programs that can help people. You don't have to actually go in, and there are in communities, they have groups there where you can actually meet others and talk who are struggling with similar addictions and get a sponsor to help you, stay off of whatever it is that you've been addicted to. Very, very helpful. And 8 of those 12 steps are religious in nature. So,
Yeah.
yes, I
And so he's in government now. You would think that we could move the needle in terms of even getting funding for more of those type of prescriptions. Yet he's getting criticized for these wellness programs.
yeah, I think wellness programs that emphasize a person's faith, their behavior, their diet, their exercise, their lifestyle. All of that I think is terrific. And I think that will help to reduce the chronic illnesses that we're experiencing in our country.
Yeah.
And especially if you work them all together, if you have a strong faith, you're part of a religious community that's supportive and you're supporting others and you're eating a healthy diet and you're exercising regularly and you're not smoking or drinking excessively. All of that's it's gonna help you be healthier and happier and live longer and
You know,
not need as many health resources.
I hosted a lot of events called Invent Health. My partner was the chief medical officer, United Healthcare at HP. We had a ton of technologists and scientists that came to our quarterly events in Silicon Valley. And I had 1 hour long segment on religion, and the feedback was terrible. Because we had so many scientists and technologists that wanted to understand the new tech innovations to save us from our own mental problems. And so, do you face that pushback?
I'm not surprised. Scientists have their own religion, and
Mhm.
it's called science.
Mhm.
And so they're going to any threat to them is going to be considered a threat. And so again, science and religion work beautifully together, but they tend to conflict. They tend to, criticize each other, and they tend to compete for people's attention.
That's like
And
a
that's
marriage.
that's
Husband and
a
wife, they complement each other and they conflict all the time too.
Yeah,
Husband
but
and
it
wife.
really it works for people's health. It works the best when they complement because they're addressing different aspects of a person's health. The religion is the spiritual, the psychological, the social, behavioral, and the science is the biological because we live in a biological body that is going to have problems and it can make life so much easier. And when they work together, it works beautifully when they complement each other.
Yeah, and you have brought those two together because you started the Center for Spirituality, Theology, and Health back in 1998. I found it surprising that it was nested in Duke Medical School, even though Duke University has its religious roots. But the psychiatric industry has always tried to sort of separate itself from theology. But you brought it back together. So in the 19th and 20th century, we have them separated, and you've brought it together to coexist. Was it difficult for you to convince the Duke Medical School to have a theology department inside? I mean, it is not something that's required of medical schools, right? They may have one course or two courses. Very few medical schools actually require any of these. And here you are putting a center inside Duke Medical School. What was that like trying to get them to, give you the green light?
Well, it was a very gradual process, and we really never did get it into psychiatry because I was trained in geriatric medicine at Duke. That I came in for a 3 year postdoctoral fellowship in geriatric medicine, and that's when I got my biostatistics training, etc. And in the Center for Aging in the Department of Medicine. Um, there was more receptivity to it. So back in 1995, I developed a program on religion, aging, and health. And again, people were not as threatened when you were dealing with older people because they figured these are old people and they're going to be dying soon, and so it really doesn't matter. But now it's expanded beyond just older people to include people of all ages. And in fact, it works best when people who are young adopt it because then it'll affect their entire life trajectory. They'll be healthier and happier across their lifespan. And so it's don't just go to it when you get old and disabled and are unable to go, to cope. Go to it when you're young and you'll have a lifetime of greater peace, meaning, purpose, and health. So in any case, it 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 is still rooted in the Center for Aging in the Department of Medicine. And I'm in the Department of Psychiatry, and it's separate. It's separate still. And there are, my department sees me as different. And I'm just thankful that they're tolerating my presence in psychiatry and haven't retired me yet. But I have no intention of retiring soon, I can tell you that.
But hey, you found a way. You found a way to bring it in. It's relatively close, and there are a lot of students who now can take courses. Maybe they're not required to, but you found a way, and I applaud you for that. What's the biggest impact? And this is my last question because I know I have to let you go. The biggest impact you've had with the center, what's the legacy you'd like to leave with that center?
Well, I think developing the workshops that we're doing, the Duke University workshops on integrating spirituality into patient care, on conducting research on spirituality and health, moral injury, human flourishing, all of these workshops that I have at the center that we're doing ranging from 1 day on a Saturday to 5 days for an entire week during the summer. I think these workshops, if they were to continue, that would be great. I would love that. And we don't really work much with the divinity school at Duke University, but there are people in the divinity school, for example, Warren Kinghorn and Far Curlin, who have a program there. And it would be great if they were to eventually adopt some of these workshops and they would continue to hold these workshops that train healthcare professionals on these topics related to religion and health. I think that would be a wonderful thing.
Okay, well, your job's not done. We need you for
Thank,
another 2 or 3
thank
years.
you. Another 20 years, Mandy, another 20 years.
Oh, you're still young. You'll be there. And
Yes.
you're in good mental health and physical health, I'm sure. So,
Amen.
uh, Dr. Koenig, thank you so much. I've been speaking with Dr. Harold Koenig. He's founding co-director of Duke's Center for Spirituality, Theology and Health. I'm Bambi Francisco Roizen. You've been listening to CRT.